And here with more, plus answers to your medical questions in our Ask the Doc segment, is Dr. Msonthi Levine. So a fecal treatment, not something you typically hear about.
No, we don't, but it's been around for a long time. You know, sometimes patients they don't respond to the typical medications that we use, normally a medicine called Flagyl and a medication called vancomycin. So some patients have to undergo several treatments before they get cured. This might take several months. As this person indicates, it can really impact your lifestyle. You can't go to work, you can't be a mother, you can't earn a living. So you want something that works. So fecal transplants are not something we jump to initially. And to be honest with you, I don't know if we're doing that here locally yet. Probably we would have to send them to a tertiary facility, maybe in Houston. So it's been talked about for many years. I know a lot of people look a little weird when they think about receiving someone else's fecal matter, but it works. And if you talk to anyone who's ever had C. diff colitis, it's not something that you want to have. You're in the hospital, you're dehydrated, you're having loose bowels, you don't feel very well. It's terrible. And the longer it goes, the more physical symptoms occur, physical deconditioning, depression, bed sores, electrolyte abnormalities. This can kill you, okay? We don't see it that often, but it can kill you. If you come in and you already have COPD, heart failure, renal failure, then you get C. diff on top of that. That could really knock you over the edge to a point where you don't ever walk out of the hospital, which is why we talk a lot about antibiotic stewardship. You don't need those antibiotics. Let's see if we can do without it. It's so hard to break. It's very cultural, but that's one of the reasons why we strongly recommend if you don't need the antibiotics, don't take them, because this is what can happen if you do.
Okay, on to some of our viewers' medical questions. Can a fibroadenoma turn cancerous in the breast? And I probably didn't say that right.
Yeah, fibroadenoma, typically not. It's not cancerous. A lot of times the pathology can be questionable. You can always do surveillance biopsies, surveillance mammograms to make sure, but typically not.
Okay. Has it been documented for vitamin C causing hot flashes?
I don't know. I mean, vitamins do so many wonderful things. A lot of research studies out there. It's not something that I typically recommend on a regular basis for hot flashes, typically hormone replacement therapy.
Okay. I had a C-section almost 5 weeks ago. Congratulations. I have a rash all over. Benadryl oral and topical do not seem to give me relief, and the rash flares up worse at night. I stopped taking all medicines, trying to clear it up. I'm about to lose my mind. On top of that, remember, she's got a newborn.
Absolutely.
What can she do?
Well, I mean, I think it was good that she stopped her medications. She took some prednisone for 7 days. Sometimes you need it a higher dose. Sometimes you need to take it a lot longer. So it may be something else. So certainly get back to your physician, either the ER or your primary care physician, to continue doing an evaluation. I think medications are always a concern, and she did a good job by stopping.
Okay. My son got tubes in his ears 5 years ago, and they've never fallen out and have no insurance to get them taken out. What will happen if they stay in his ears?
As far as I know, nothing. As long as he's not having any symptoms, if he's hearing okay, not having any fever, no drainage, you can leave them in as long as possible. A lot of times they will fall out eventually. They don't necessarily have to be taken out, as far as my understanding in those.
All right. We've got lots of other questions. We'll get to those in just a minute. So don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says, I have problems with sciatica. Can you address it?
Yeah, it's basically a nerve compression. We talk about a lot. If you have a lot of sitting, long trips, sitting at the office, it can compress the nerve in the buttock area. You may feel some numbness and tingling radiating down your leg. A simple solution, just get up and move around. Sometimes we use medications like Neurontin to help, but it's typically a simple solution.
Okay. What could cause a fever of 103 and chills for 16 days in a person with diabetes and high blood pressure? They've ruled out a bacterial infection. All blood tests come back fine. Protein in the 24-hour test was 5121. They need help.
That's not right. I mean, that's abnormal. So get back to your doc, continue the repeat evaluation. I think bacteria would be on the top of my mind, but viruses, fungus, sometimes non-infectious inflammatory conditions such as lupus, connective tissue diseases, abscesses, cancer. So you have to get back to your doc. Still a lot of work to be done, but that is abnormal. Don't let that go away without any further workup.
Okay. What causes headaches in your eyes for 3 days?
That's tough. Sometimes migraines can cause that. Sometimes increased pressure in your brain can cause that. Certainly anytime you have pain that lasts that long in your eyes, get it checked out. Sometimes glaucoma can cause it, might need an eye exam, so certainly more evaluation is necessary.
Okay. I have an irregular heartbeat. It's not my thyroid. What can cause it?
You know, as we get older, our heart rate and electrical system of our heart tends to degenerate, increase the chance of having these abnormal heart rhythms. A lot of them are benign, but as we get older and develop heart failure, they can be malignant, such as ventricular tachycardia. You may need a defibrillator. We like caffeine, so it's in everything. That can be a simple solution, just to stop drinking the caffeine. But if not, get to your doctor. Beta blockers is a medication we like to use for that problem.
Okay. What does it mean if you wake up 3 or 4 times a night to go to the bathroom? And I mean every night. Depending
on the age, that might be diabetes, that could be a bladder infection, that could be overactive bladder, could be caffeine. So normally what we would do is a urine sample and some blood work. Maybe even try you on some medication to figure that out. Certainly abnormal, I would get that checked out.
Okay. Can a pulled muscle, specifically below the left knee, last for 2 weeks?
Certainly it can if it is severe, and certainly if you're continuing to aggravate it, if you're a runner or you work out a lot and you feel that pain and you just love going to the gym. So absolutely, but the longer it stays injured, then the longer it's going to have pain, and you don't want to do that. Take care of it right now.
Okay. What causes night sweats?
A lot of times we don't know. Certainly, again, related to the age, I might be concerned about malignancy and might do some x-rays. Thyroid disease can do that. Medications can do that. And certainly temperature in the house, about 85 degrees, can do that under a lot of blankets. So,
so just take a look at all of that.
Absolutely.
A woman with Rh negative blood. Her son has a disease where his blood platelets are very high, above 1,400. Could the two be connected?
I don't think so. Two different issues. Could be something wrong with the kid's blood, bone marrow. Certainly get to the physician, hematologist. Might need what we call a bone marrow biopsy, but I don't think those are connected.
Okay. What causes tunnel vision, blurred vision for 30 minutes to 2 hours at a time, and then it turns into a headache?
It could be a precursor to a migraine headache. We call that an aura, A-U-R-A. So typical classic presentation of that. Good medication on the market, Neurontin, Lyrica, Topamax. So get to your doctor for a prescription.
All right, Dr. Levine, unfortunately we are out of time. We've answered lots of questions.
Yes, ma'am.
Appreciate your time, and you can always visit our website to see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com or post those questions every Monday on our KFDM News Facebook page.